Hi VSG and WLS YouTubers, this is VSG Gary and this is my week 45 post-vertical sleeve gastrectomy update. Today is Monday, July 6th, 2015. I had surgery on Monday, August 25th, 2014 at Grandview Hospital in Dayton, Ohio. My surgeon was Dr. David Bruce and all is well. Sorry, last week's video, I guess, got 30 or 30 so seconds into it, and everything went screwy. I don't know what happened. I ended up taking it down and thought I'd have time to do another one, but in fact, I did not. So I'm kind of lucky I have the time to do it. I'm just getting ready to go to the gym and do some weights in a little bit. But I've put in 12 hours at work today and ate a little too fast, so slow, you idiot. So just waiting for my stomach to straighten out, and then I will go. So started this journey on November 1st, 2013. I weighed 394 pounds. My surgery on the date, my weight on the date of surgery, that's the picture. YouTube will, I guarantee it, was 337 pounds. And as of this morning, it has stayed this, my weight has stayed the same for 5 days, so I'm officially in another stall. That's just me. I stall. Was 194 pounds. So I have lost 200 pounds since this journey started, so it's unbelievable. And 141 pounds, 144 pounds, something like that, since the day of surgery. 37 and 6 is 43, 143 pounds in surgery, so I'm okay. Ugh. Product of Dayton Public Schools math. I always got A's in algebra in college. Oh well. Before calculators. So anyway, last week was a good week. Last Monday I had blood work done. Thursday I was supposed to meet with my surgeon, but he was obviously tied up with a gentleman in the room next to me that was having really bad stomach pain. And he had had surgery, I think 3 or 4 months ago anyway. They were trying to get a squad to him and get him over to the hospital and scope his stomach and see what was going on. I guess, so I heard a lot of things, so we'll just bypass that. Most everybody's good with this. So I saw his PA, his physician's assistant. She's pretty new to the practice, I guess. Delightful young lady, and she rides a bicycle all the time. So we had a great talk. So my numbers, my blood work, everything was perfect. Everything was smack dab in the middle. So except one, and that was my BUN. That's the creatine for my kidney. The number would have sent my personal physician into shock. But the PA insisted it was because I'm on a high protein diet and may have been a little dehydrated. She wasn't all concerned about it. She said, obviously you look great. So, and then she said, I wasn't supposed to lose this much weight as quickly as I have. You want me to put some back on? I will. But talking somewhere about the first year, you lose probably 60% of your excess body weight, and she says you're practically down to an almost normal weight. So that was good. Will not argue with that a bit. She also went on to say that there's some new studies out for people who have had vertical sleeve gastrectomies, that I can expect to continue to lose weight for the next 18 to 24 months. Um, yeah. So I had some complaints that I talked to her about, that my stomach, my sleeve feels more restrictive than it's ever been, even the few week or so after surgery. She said that's probably normal. Uh, um, I had to fill out an umpteen-page questionnaire before I saw them, and I did that online, thank goodness. And one of the things I put is I have stomach pain, but I think it's because some things I eat doesn't bother me at all. Other things, as I expand my food horizons, bother me. So I told her that I personally think it's just a case of not adjusting yet to some of the harder meats. You know what I mean? Steak, um, turkey, chicken, fish, fine. Don't have any problem with those. Pork chops, pretty dense meat. Steak, pretty dense meat. Um, 2 or 3 ounces hurts. So we had grilled pork chops tonight, and I only ate half of it. It just so hey, um, it is what it is. So she wanted to know if I exercise. Do I exercise? Oh, that's what brought up the bike subject. So we spent the rest of the time talking about our bicycles and bike paths and so on and so forth. So last week when I made the video, I was in a recliner downstairs with an ice pack on my left leg because I went down really hard on my bike. Bike's okay. Concrete I fell on, I was okay. You know, I had a neighbor that saw the whole thing, a husband and wife, and she comes running up and says, "You didn't crack the concrete, did you?" Now that's something you'd say to a fat person. And no, I didn't crack the concrete, Sandy. But anyway, I was coming out of our garages, and a woman who doesn't live in our complex was riding her bike right along the curb. And I usually listen for cars, and I sort of pay attention, but I didn't see. And there she was. She didn't move an inch. She had a whole street. She could have. There's no traffic back here. She could have. She didn't. I couldn't get unclipped fast enough. I was moving very slowly, but down I went. My right hip, my left ankle from the knee down. So I laid off the bike for a couple days. Got back on last Friday morning before we went over to Indiana to visit my son and daughter-in-law and their grandson for the weekend. Great trip. Got home yesterday. Last night I did some cycling too. I'm watching a pair of hummingbirds that we feed that are coming up on they're at their perching spot where they overlook our patio down here. Anyway, love the hummingbirds. But, so I digress again. Anyway, all is well. I don't go back to see the doctor again until the 1st of October, and then I'm free for a year. We talked about my hernia. They're not going to do anything about that till at least 2 years out, unless it really bothers me, and it's not. They want to wait till I've lost all the weight that I can lose, and she says, "You'll know because your body will just stop." So every time I have a stall, I think, my body's just stopping. Maybe, maybe not. We'll see. I would be okay at this weight. We talked a little bit about loose skin. I have loose skin like you cannot believe. But then I think so do all of you. She said again they'd wait 2 years, see what happens. I kind of found compression underwear, you know what I mean? We're friends. So that helped a lot. So that's it. I am on my way to the gym. So you all have a great week. One thing, I emailed Facebook and said, how do I get all my contacts from my old VSG Gary page? And they emailed back and told me how to do it. So I guess I'm in their good graces again. So I'll try to get all those moved over and talk to everybody. So in the meantime, God bless everybody. Keep traveling. Have a good week. See ya. Bye.